hand versus chainsaw. It looks painful.
Our hospitals are taking care of more patients than ever.
You're right.
With medical teams under constant pressure.
Can Dr. Pixie come to Resus, please?
Somebody as poorly as this little one, we really need to treat them quickly.
To meet our expectations.
I'm just worried about what it's going to be like afterwards.
But there's a crucial member of the team we sometimes forget.
I've never ever been on a bed like this.
The hospital bed.
Another ward, another storage, another bed.
In our lifetime, we are likely to need one of them at least 3 times.
I've probably spent a quarter of my life on a hospital bed.
In this series, our cameras have been given unprecedented access to beds in 4 very different hospitals across the country.
It's life and death and everything that goes in between.
We'll see the world through the bed's eyes.
Hello, my love. Hiya.
As they share the most challenging,
I don't know what to do. I don't know.
most intimate, and most rewarding
Happy birthday!
In hospital's wonderful.
moments of our lives.
Thank you for being here.
Have you been anywhere else?
And a hospital cannot function without beds. Beds are vital.
This is the secret life of the hospital bed. Queen Elizabeth Hospital in Birmingham is home to over 1,200 hospital beds. More than 80 of them are on the day surgery unit, where people come for a range of surgical procedures.
Can you do me a favour? Can you just do a quick whiz round and find out where he's doing, this gentleman, because they're sending at 12:30. Lovely, thanks for your help. Bye.
Michelle Duggins is the bed manager for the ward.
Our beds are always busy. You have to know what's going on. You have to make sure that the people that you are working with are aware of what you're doing, because it affects everybody down the line. You in here, Lena? 25. This is the right. You okay if I bring them in?
These
Yeah,
beds
lovely,
can
thank
work
you.
long shifts. They're on call from 8 in the morning till 8 in the evening. Today, Bed 81 has been joined by Bricklayer Chris, who's come in for treatment of his skin cancer.
I got a mole removed 5-6 weeks ago, and I've come back now to get a tummy tuck.
He's come back to get more skin in
No,
the area.
more skin removed, so yeah.
Cancerous.
The operation will take a 3-centimetre ring of flesh from around the area where the mole was removed to check if his cancer has spread. Providing bedside support is his partner Geraldine.
It's a big C.
Well, when we first heard the word,
Yeah.
it was terrifying.
Went into the room, and the doctor says, "Oh, by the way, this is Samantha, your cancer nurse."
That was a bit of a shock.
What?
Yeah.
Your cancer nurse, okay, right. It wasn't very subtle, you know.
No, it wasn't just, no.
But there's no easy way of telling anybody that, isn't it?
That day when we were told, I started to cry.
Mm-hmm.
But then,
Yeah, and then there's a different doctor came in then.
Dr. Cock,
Dr. Cock.
he was lovely.
He was lovely, explained it very well. But he went into too much detail, you know. He sort of scared me then, so he did, you know, really.
52-year-old Chris is one of 5 people in the UK treated every day for skin cancer caused by sun exposure at work.
Probably due to too much sun on my back. I'm a bricklayer, and I tend to take my shirt off. When we get a bit of sunshine, pale face, pale skin. All right?
Well, very probably.
Yeah.
Chris and Geraldine have been together through thick and thin for the last 33 years.
Is it that wrong, is it?
It is, I'm
Wow.
afraid so.
Does the
33.
time fly?
When you're having fun. First night I ever set eyes on him, he came into a disco. He came in with sunglasses on him. He's so cool. Dark sunglasses. Yeah. And I thought he was gorgeous. Yeah.
It was Geraldine who first spotted the problem.
I found a mole on his back. It changed shape.
Yeah, there was flat mold,
Small
and then it started to raise up.
Now you see you're getting nervous too. Just wish this was over.
Consultant surgeon Dr. Athanasiadou will be performing Chris's operation.
Let me just close the curtains.
Yes.
Due to the thickness of the melanoma that you have, I need to remove 3 centimeters around the scar. Once I remove this specimen, we send it down to the lab. They will look at it under the microscope. They will tell us if there's anything in there, if there's any melanoma cells in there. You will have to have some time off.
A couple of days.
A bit longer than that. A couple of weeks until we'll see you shortly in theatres.
Okay.
All right, thank you.
Thanks, doctor. Okay. No way, I can get 2 weeks off work. Get a couple of days. I'll be back on Wednesday, Thursday.
Aye, all right.
2
Thursday
days,
week.
I think. 2 days.
Yeah, that's right.
Malignant melanoma is the 5th most common cancer in the UK. But with a 90% survival rate, the odds are good if caught in time.
Yep. Yeah, I'm good. Yeah, good.
Ready?
I wouldn't say I'm ready, but...
I wish it was all over.
Have you had something like
this before? Yeah, well, he just had the mole removed itself.
So this is more...
Just please God, it's all right.
Yeah. Okay, ready to go.
Right.
All right, babe.
I love you, Dad.
All right.
All right, we'll look after it.
Yeah.
James, I'll let you know.
Day surgery bed 81 will support Chris throughout his stay. It will be with him as he's delivered to surgery and will wait patiently whilst he undergoes his procedure.
It is, for us, a relatively small procedure, but for him, surely something significant.
In the northeast, Newcastle's Royal Victoria Infirmary has been caring for its community for over 250 years. Its state-of-the-art A&E department has more than 40 beds and 6 specialist Resus beds, which all have life support machines.
I've just got a lady who helped me to pop a tube in and get a CT head done on. She's an alcoholic, hypotensive, collapsed, GCS about 4 or 5.
A hospital cannot function without beds. Beds are vital. We are responsible for beds 24/7, 365 days of the year. There isn't an unlimited number of beds. We do come up against pressures, and especially in winter, our phones don't stop ringing constantly all day. We just try and keep the flow going as much as possible.
The unit's Resus beds are reserved for those with life-threatening illnesses or injuries. It's 11 o'clock in the morning. Staff are on high alert as there's a patient coming in with a very serious condition. He's taken straight to Resus.
Hi Rosie, it's just Gemma. Do we have another cubicle around there? Yeah, the patient's only just got here.
Resus bed 5 is standing by. 65-year-old David has been rushed in with suspected sepsis, which is the body's reaction to a severe infection. Sepsis can kill. David needs to be injected with antibiotics.
Hello there. My name's Pixie. I'll be your doctor today. Right, what I need to do, my love, is listen to your lungs and your heart and all that. Okay, and then we'll take some blood and things. All right? You're feeling weak.
Within minutes of being on Resus bed 5, Dr. Lan Ping Nam gives David the potentially life-saving treatment. If it is sepsis, she can't afford to wait for test results. Nurse Campbell has been working in the A&E department for 12 months.
They haven't definitely got the results back from his urinalysis, but all the indicators are there to say that he's got urinary sepsis.
Will I just run the rest of that fluid through?
Yes, please.
As doctors try to stabilise David, healthcare assistant Belle sheds light on his condition.
This gentleman's acquired sepsis. Until we have the bloods and one thing and doing routine tests, we'll not know where the sepsis is. So it's massively serious. All over the news, everywhere at the minute. Is one of your biggest watch out for is the sepsis now.
75 systolic.
David has now been in Resus for half an hour. One of the symptoms of his sepsis is getting worse.
His blood pressure is low, hence why we've tilted the bed.
Just see how good his blood pressure being so low on wood. I'm just going to pop a little scratch in the end of your finger, sir, just so I can check your blood gases, okay? Just keeping you flat for a little bit because your blood pressure's a wee bit low.
Up to 4 in 10 people with severe sepsis will lose their battle to stay alive. David's life hinges on whether it's been caught in time. The Great North Children's Hospital in Newcastle has 246 beds.
So, what's happened with you, John?
I fell off a bike.
Fallen off your bike?
They're the smallest beds in the hospital, providing specialist care for teenagers and babies and every age group in between.
I'm coming, don't worry.
Everybody's coming.
On average, 100 children a day will arrive at the paediatrics emergency department.
I've just had 4 referrals from another hospital. However, as far as I'm aware, we don't have any beds at the moment. But again, we can't refuse the patients if they need to come. We'll just find beds for them when they get here.
Bed 27 is freed up and ready to see its second patient of the day.
Thank you.
And if you just pop him on the bed there, if that's okay.
Oh.
6-month-old Etisham has been rushed in by ambulance after his mum and grandparents noticed a serious rash all over his body.
Has it carried on getting worse?
Yeah, I think
so it hasn't got any better at all. Okay. What we'll do, we'll get one of the doctors to come and have a little chat with you and we'll see what we need to do.
Okay.
All right. Lovely. Thank you.
Thanks.
Any allergic reactions in babies this young can be life-threatening. Dr. Cummings is quick to attend.
Hi. Yeah.
Hello, my name's Dan. I'm one of the doctors.
Hi.
How are we doing?
I give him pasta food. After 5 minutes, when I see he's got like red patches and white patches on his body, and it started getting worse and worse. His ears and his face and everywhere. It's still there. It didn't go away. It's quite itching as well.
Okay. Has he ever had anything like this before?
No, it's first time. First time right here. Thanks.
Hello, little man. How are we doing?
I just move the chair.
Allergic reactions are potentially quite dangerous because they can affect the upper airway and have cause difficulty breathing. So it is important that we get allergies checked out, especially if it's the first time it's being experienced.
Dr. Cummings' priority is to ensure Etisham's airway is clear.
Okay. It's okay. Just checking his tongue's not swollen up.
Oh.
Okay.
Yeah.
Okay. Is there any allergies in the family? Has anyone got asthma, hay fever?
Yeah, he had eczema, dry
Okay.
skin and stuff like that. Yeah, my husband had eczema as well, and he had a hay fever all the time as well.
Okay.
Yeah, and family, yeah, we have allergic peanuts or nuts and stuff like that as well, and meat as well.
Okay, so we're fine. Etisham family have got quite a significant allergy history, with a couple of the family members having very severe allergic reactions, which means they've got to carry adrenaline pens. I'm really happy that the reaction hasn't been that severe because they're really scary and potentially life-threatening. But with such a significant family history, it is important that we consider that there may be a more severe reaction down the line.
I've got some medicine for him to help with his scratching. Yeah, and to help with his rash as well. Okay.
Yes, nice. Nice, lovely medicine.
Oh, it is a bit funny, this one, doesn't it? There we go. There we go. All done.
Thank you.
All done.
Etisham needs to stay on bed 27 for observation. The next 3 hours are critical.
Thanks a lot. Thanks.
It's early afternoon, and all of the beds at the A&E department of Newcastle's Royal Victoria Infirmary are busy. A&E Bed 9 has picked up its latest patient. 27-year-old Peter has been rushed in by ambulance.
What have you done to your arm?
Cut it with a chainsaw.
Chainsaw? Why not there?
Just another day in the office, isn't it?
Landscape gardener Peter has already been given morphine after having an accident with a chainsaw. Trauma consultant Mr. Good wants to take a close look.
What we're going to do is take that dressing down. Okay. Have a look at it. Steve's going to take a picture. And so once we put the dressing back on, people don't keep coming along and taking it off all the time.
No problem.
Okay.
Nurse Griffiths has only worked in A&E for a year, but this isn't the first chainsaw accident she's seen.
You don't know what's under there until you get the dressing down, and often when they're picked up and there's lots of blood, you can't really tell what there is either. So you just have to take it as it comes and be prepared for whatever's under there.
Don't look at it if you don't want to.
I heard that.
I want to touch down on your thumb here. Can you feel that?
Mm-hmm.
Yeah. Okay. Straighten that finger out for me. And then you're allowed one swear word. Straighten that one out. And then straighten that one out. And that one. Good. Now, can you feel me touching that one?
Mm-hmm.
And that
Peter
one?
doesn't have full sensation in all of his fingers.
Yeah.
Nerve-wise, if you've gone through nerves or tendons, you can lose the movement in your hand. You can lose the sensation. So that's also like a life-changing event.
Mm-hmm.
And that one?
Mm-hmm.
All the way down either side of it?
Yeah.
And all the way down either side of here?
Faintly.
So it's not quite as good on that one as it is on that one, yeah? What I'm going to do is ring one of the plastic surgical team and ask them to come down and see him, because he'll need to have these wounds explored.
It'll be down to the plastic surgeons to decide what course of action is needed to save any damaged nerves or tendons. A&E Bed 9 and its patient Peter head to the X-ray department.
Hand versus chainsaw.
It's just like gone, bounced off his hand.
This is painful.
It looks painful.
Half an hour passes and there's no sign of the plastic surgeon. The pressure to clear Bed 9 is increasing. Sister Hill's job is coordinating patients and beds in the department.
As a national target, we try and make sure patients are seen and sorted within 4 hours. This patient's been here for about 3 hours, 10 minutes at the moment. So my job as a nurse in charge is to start facilitating movement.
Bed 9 is at risk of running out of time. In the area of A&E reserved for critical patients, Resus Bed 5 has been occupied by 65-year-old David for over an hour. He's being treated for sepsis, a life-threatening condition. His blood pressure is dangerously low.
I think we'll have to make him well enough to go to monitoring just that. His blood pressure still keeps dropping.
Sorry, mate,
Sepsis is the body's reaction to a severe infection and has to be caught early. Without quick treatment, it can lead to multiple organ failure, meaning David could die.
all that fluid gone through, is
Yeah,
it?
that one's gone. The gentamicin's just about finished.
Mm-hmm.
Do you want another bag?
Yeah, we can have a
Still-
further 500.
Another 500?
Yeah.
He's had IV fluids and IV antibiotics, which he has had as well, so we're treating him as definitely being septic.
Hospital staff are on high alert for sepsis cases.
Sepsis, it could be anywhere. It's a bad infection anywhere, and it can kill patients quite quickly, especially the elderly and the young.
David has now been in Resus for an hour and a half. The antibiotics are starting to take effect and he's showing signs of improvement.
He does look a little better now and he's ready for a sleep now.
Not for too long, alright?
He does, he looks a hell of a lot better.
He does look a lot better. Alright, wait.
It appears the worst may be over.
There's a bed on the assessment suite for David. Yes. Have you got to go now?
Yes, yeah.
David is finally stable enough to be moved off Resus bed 5 and onto a ward. It seems the antibiotic injection caught the infection just in time.
From our point of view, he's a lot more stable than what he was when he first came in. So we've got a monitored bed from the assessment suite where we'll be under the medical team, and they'll just carry on treating his sepsis and get him a little bit more stable. They normally stay on the assessment suite for maybe 24 to 48 hours.
We'll get you right in here, we'll get you comfy, we'll get you sorted.
With a comfortable few hours on the ward, he's starting to rally.
When I first woke up, I was a bit disorientated the first time. And then I came back to us after a little while where I was. I'm fine.
David will have to stay in hospital overnight to continue his treatment. Romford in Essex has one of the busiest maternity units in the country, with more than 8,000 babies born every year.
Good girl. That's it. That's it. That's it. Go
Oh, welcome to the world. Hello. Happy birthday to you. Hello, Mummy.
Hi, Mike.
A little push in the right direction makes a big difference.
With maternity beds in high demand, no sooner has bed 7 brought a baby into the world than the next is due. Blessing and husband Kasim grew up together in Ghana. She's 10 years older than him, and this is their first baby together.
We know each other from childhood anyway.
Yeah.
So,
I used to take him to school.
take me to school.
Yeah.
now the truth will come out. How old are you?
Okay.
Hello.
Hi. I'm Dr. Muhammad, the registrar of the day.
Hello.
How are you? Do you feel any pain at the moment? You had your water broken in the morning?
Yeah.
At 11 o'clock?
Yeah.
The water was clear in color?
No, the color was greenish.
Greenish?
Yellowish?
Yeah. So, I'm going to just to examine you from below down to check what's going on.
Blessing is determined to have her baby naturally, but her waters have broken early and are discoloured. This can be a sign that the baby is in distress.
So, I've examined you, and we are worried about the heart rate. All the best for you.
Okay, thank you.
See you later.
The baby's heartbeat is irregular.
Thank
It's now
you.
crucial to induce Blessing to speed up the birth to avoid an emergency cesarean.
You need to have full contraction in 10 minutes, okay? Nice and strong, regular, okay?
In Birmingham, at the day surgery unit of the Queen Elizabeth Hospital, Chris is parting company with Bed 81. He's moving to an operating table for an hour-long operation to remove potentially cancerous skin from his back.
And then just feel for the edges because this bed is quite narrow. It's a lot narrower than this one.
You don't want me falling wide.
The skin will be sent for tests to check if the cancer has spread or is likely to return.
I've worked here for 2 years and I still don't know the way around those cancers.
Of course, yeah.
The procedure will be carried out using a local anaesthetic,
Anxious though, just to get it over, you know.
allowing him to recover more quickly and be awake throughout.
It's nice to be conscious and know what's happening rather than knocked out.
Yeah, because it's time after
Probably should have it done long ago. Yeah. I was always fearful of the worst, you know. I kept putting it off.
Chris had ignored the mole for almost a year.
So is it a busy period for you this time, work-wise?
Yeah, it is, doctor, yes. That's what I say, that's why you have to go back to work on Wednesday.
Yeah.
But thanks to the persistence of his wife Geraldine, he's here having this potentially life-saving surgery.
Thank you.
He's just a typical man. He will not go to the doctor. So I kept at him and I made him go. So thank God I did. Thank God he did go.
For Chris, this is the beginning of a long process. If it all goes well and the biopsy of this specimen comes back clear, then he will just be followed up in our clinic for a few years to come now to see that he's not coming up with a recurrence or a metastasis of his cancer.
All day surgery bed 81 can do is wait while Chris undergoes the procedure. For wife Geraldine, it's a difficult time.
It's always terrifying to hear the word cancer because you just imagine it's the end of the world. You just have to keep going, be strong. He says he wants to get back to work for Wednesday or Thursday, and I've told him no way, that's not going to happen. So there's no point in arguing with him. I'll be telling him he's not come back to work, and that's it. He's a very strong person. I suppose I just love him.
Back on bed 81, and Chris makes his return to the daycare ward.
Everything's all good.
Okay, nurses will be with you very shortly, but there's the buzzer if you need anything in the meantime.
Okay.
Don't try and get up on your own the
Okay,
first time.
thanks very much. Thanks for keeping me talking. That kept me
no problem.
occupied.
I can talk for England, mate.
That's good. Good. Thanks, nurses. Brilliant.
Operation over, he can relax with a cup of tea and a sandwich. He should be on his way home in an hour.
Well, darling.
Yeah.
I was just trying to talk them into keeping you overnight.
Yeah, no,
and I can go clubbing. You all right?
Yeah, good.
Good.
That was with her solder now and she burnt it out.
Oh, you're joking, are you?
I thought she would have cut it out, you know.
Oh,
No.
the smell then.
No,
It'd be horrible.
No, this is better, she said.
Chris, just do your blood pressure.
Yes, again, good man.
Yeah. And then if this is
Good.
okay, you can
Right.
get out of bed.
Good man.
Okay.
Yep.
Any pain at all?
No, it's all good. The only pain I have at the minute is sitting there.
Oh no.
Oh, you'll no pain tonight when I get you back to the house.
Hospital beds see everything. Tears, heartache, happiness, and all that's in between. Day surgery bed 81 can rest assured that Chris's future care will be in safe hands with Geraldine.
Oh, here you go. Look, there's your ball and chain back on again. There you are.
Oh, I thought you forgot about that.
Oh, you wish. You wish. Not likely, Dan. There you are.
Ah, there's back.
It's been an exhausting day for both Chris and Geraldine, but after 4 hours on day surgery bed 81, it's time to go home.
Right, that's us. Let's go. Thank God.
Today, went fantastic, didn't it?
Well, it went really well.
Well.
I was very nervous this morning. I really was. I just hated the thought of it, but I am so relieved now.
Relieved, yeah.
Chris and Geraldine have to wait around 4 weeks to get the results of the biopsy. Bed 81, meanwhile, is free to be cleaned down, ready for its next patient. In Newcastle, bed 27 on the paediatric A&E ward is still with baby Etisham, who's been under observation for the last 3 hours. He was brought to hospital after having an allergic reaction to trying pasta for the first time.
Oh, you're not feeling well. You're not feeling well. Oh, poor baby. I start giving him solid food when he's 5.5 months. So it's almost like two and a half weeks now. I never give him pasta or anything like that before. Normally just fruit or carrots like that. So first time I try, and then it's happened.
Etisham was given an antihistamine earlier. Dr. Cummins is back to check his progress.
The colour is, I think his redness is a little bit less now. Before it's quite a lot.
A little bit better.
Yeah, let's see. From here as well, it was very red before. Now it's quite better.
No, I think he's looking a bit less red.
Yeah, he is, yeah.
So I think this medication we've given him has worked. So, and what we'll do is we'll give you the same medication we've given him to take home, just as a liquid.
Okay.
And obviously the first thing to do is to advise mum that if he gets any of these symptoms again, she can give him this medication and then either to ring her GP or ourselves, and we'll happily see him again. In the meantime, what we're going to do is put a referral through to the allergy specialist doctors. It may be that just because he's had a mild reaction to this, we can't avoid the fact that he may also have a more severe reaction to something else as well. So it's important to identify those factors so we can minimise the risk.
We are going home now. You're better. Doctor said you can go home and you can have your medicine tomorrow, that's it. And then we can be normal
After 2.5 hours, Etisham is ready to leave bed 27.
Yeah, we can give him 2 doses tomorrow, just to make sure it does get settled down. But otherwise, just as and when. But give us a ring if he gets any symptoms.
Thank you.
Bye-bye.
Bye. Thanks very much. Bye.
Bed 27 is freed up and ready to receive its next patient. At Romford's Maternity Hospital, bed 7 is looking after first-time mum Blessing, who is desperate for a natural birth. When her waters broke, they were discoloured and the baby's heartbeat is irregular. Midwife Pattinson knows that if the baby doesn't come soon, Blessing may have to have a C-section.
Sometimes they can't cope very well in labour, so we tend to see them get a bit stressed out, and sometimes they can go for a caesarean, or they can sometimes need help with just delivering, so the doctors might help with like forceps or a ventouse, so the suction cup. Okay.
Blessing has been induced to try and speed up the labour so she can still give birth naturally.
Any difference or still the same contractions?
No.
The same?
No, not the same.
A little bit stronger?
Yeah.
If you need any pain relief or something like that, let me know, okay? Because gradually pain will keep increasing.
Okay.
So you can just let me know about it.
Okay.
Pain. Don't be shy to scream, yeah. Yeah, waiting to see what happens.
Very brave to have got to this point and not used much pain relief. Most people have an epidural very quickly because they can't cope with the pain.
If the baby isn't delivered soon, Blessing may be forced into having the C-section she's so desperate to avoid. In Newcastle's A&E department, bed 9 is still with gardener Peter. He's asked to see a photo of his chainsaw injury.
You seen your photo?
It's a beaut. That'll scare the kids.
So you know, scratches, didn't I?
What happened? Did you drop it on?
No, like I put my hand out to point a branch out for a cut.
Yeah.
But he mustn't have seen my hand, he's went in with the chainsaw.
Did it like bounce on your hand?
It bounced.
Looked like it had just bounced.
It's just bounced over my hand.
Yeah.
And then about a minute later, I just started gushing of blood.
I'm not surprised.
You look how deep that one is.
Yeah. Right, we'll keep them for him in your notes.
Peter's waiting to see a plastic surgeon, but they're busy operating on other patients. He's been on bed 9 for 2¼ hours. Time is running out for this A&E bed, which aims to turn around patients in under 4 hours.
You do know?
Miss Moran?
Yeah.
Hi sir, how do you do? I'm Matt, I'm one of the plastics.
Dr. Gray from the plastics team comes to make an initial assessment.
So it's going to be sore because you've got a big cut, but I want to check how nerves seem intact.
He needs to assess whether Peter has nerve or tendon damage, which would require surgery.
Yeah. The worry is because there's a load of what are called extensor tendons, which is just to bring your hand up like this, running in this area. The thing is, have you cut through some of those? So what we'll do is, we'll cover this back up, and I'm going to have a discussion with the registrar about whether or not we can give this a good clean out, because it's obviously a bit of a mucky wound, it's been a chainsaw. And give it a clean out either here, or whether or not it needs to go to theatre.
With new patients stacking up in the waiting room, Sister Hill is pushing for a decision from the plastic surgery team.
So I've contacted Plastics twice now, the SHO, and he's coming down with his registrar, but he's on 3 hours and 55 minutes. So I've let our head consultant know, who is going to speak to the plastics consultant.
With minutes to spare, plastic surgeon Mr. Gurkani arrived straight from theatre to make the call on Peter's treatment.
Hi, my name is Bill Gurkani, I'm a plastic surgeon at CJ.
Alright.
I know we've cleaned out here, but I think we should have a look whilst we've numbed your arm, make sure that the tendons are intact. There's a nerve there that we just need to keep an eye on, make sure that's all okay, alright? The plan would be to do that tomorrow.
Not a problem.
Alright? We'll just draw a mark on you and ask you to sign a consent form. What questions do you have?
Nothing, I can't go for a tab after I've done it, I've been waiting for ages now.
Yes, smoking is bad for you though, you know that, don't you?
Yeah, I do.
Alright. In seriousness, if you do have a cigarette, it reduces the blood flow to
Yeah, I
you
know.
quite significantly. Better if you don't have it.
Yeah, I know.
Alright? You're still going to have it, aren't you? You should have said
I like the talk. Thanks very much. Thanks.
As the clock hits 4 hours, Peter is moved from A&E bed 9.
There you go, it's been handed over to the staff nurses.
Yeah.
Thank you.
I'm waiting for 47.
His next stop will be a ward and then theatre tomorrow.
It's going to all 47 now. So we've managed to hit our target.
It's been another busy day in A&E for the beds. But for Nurse Griffiths, there's a moment to reflect as her shift comes to an end.
The Reds see it all, I guess. Yeah, they see the worst and the best of people and the way people deal with things.
Look at that. Oh, feel everything rushing at the back.
I think we take it for granted in A&E that we see probably some of people's worst days of their lives every day, and it's normal for us.
Can we have that up higher?
But it is what it is, and it's people and it's life. Yes, life and death and everything that goes in between.
Maternity beds are with women throughout their labour, whether it lasts for an hour or over a day. Blessing and bed 7 have been together now for 8 hours.
Are you feeling that pressure now?
Yeah.
You ready to have this baby? You can push if you want to, but just go with your body, okay? Is that one going? Is that pain going?
Still there.
All right. She's got lots of hair.
Daddy hasn't got any.
She's got all of Daddy's hair. Go on. Go on. Really hard, really hard, really hard. Good girl. Go on. Go on. Really hard. Go on. Go on. Go on. Good girl. Breathe now. Breathe. Little push now. Breathe, 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 breathe. Good girl. Good girl. Little push. Little push.
Bring your leg up, darling.
You're doing amazing. Just go with it. Just give it everything you've got, okay? Well done. Go on, go with it. Right into your bottom if you want to push. Go on. Go on. Go on, push again. Go on, push again. Girl. Fantastic. Good girl. Well done. Happy birthday.
After an initial concern that the baby was in distress, Blessing has now had the natural birth she dreamed of.
Yeah, what's going on here?
She's very cute.
Thank you.
I get to do that for a living, so yeah, it's amazing every time. Yeah, she did really well considering that was her first baby. She was very quick, so she did very well, but pretty standard for a delivery. She did so well. I'm so pleased for her.
I'm not sure I could have handled the pain. She's done really well. Yeah.
Bed 7 has done all it can. Just an hour after the birth, Blessing, Kasim and their new baby girl are ready to leave.
All the nooks and crannies.
I get a smile.
Our hospital beds have given us intimate access to the work of the NHS. Following his chainsaw accident, gardener Peter is now recovering at home. Chris got the results of his cancer biopsy. It was all clear, though he'll need to return to the hospital for checkups every 3 months. After his short spell on Resus bed 5, David had to spend another 2 weeks in hospital before leaving. And baby Etisham is having his 5 a day, but avoiding pasta. The beds are now back on their wards, ready and waiting for their next round of patients.